NACI now strongly recommends provinces rapidly deploy a second round of boosters for people 80 and up and those living in long-term care or other congregate living settings. But Ontario planning to roll out fourth doses to anyone 60 plus. More details on that, as you heard, coming tomorrow. But this, as cases and hospitalizations are rising, particularly among young people. To discuss, we welcome back to CP24 tonight Dr. Andrew Bozzari, Executive Director of Social Medicine at the University Health Network, Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital, and Dr. Dina Kulik, Founder and Director of Kid Crew Pediatrics. Thanks to all of you. Let's start with fourth doses, Dr. Bozzari. Who needs them and when?
Yeah, and I think we saw this, as mentioned, the new guidance from NACI, I think, again, following what happened in the U.S. with the FDA, and really looking, again, for individuals who are over 80 or 70, people with higher risk. And I think, again, what we're looking at in terms of the fourth dose is trying to keep people alive and out of the hospital. And so I think we've seen this, again, where it's age-adjusted, but I think it's really important that we ensure that the vaccine is getting out to people, the fourth dose, to where there's the highest risk and structural risks and community spread of COVID. So that's something where we really hope we can start to see not only that prioritization, but it get out to people who need it the most, and especially our elders and seniors that have, borne the brunt of the risk of COVID and are in the greatest benefit of receiving a fourth dose.
You mentioned hospitals. Dr. Grill, talk to us about what you're seeing in hospitals right now. Ontario reporting a 40% rise in hospitalizations because of COVID week over week. What's your assessment of where we're at in this sixth wave, and how should this help inform us about how quickly we should be giving out those fourth doses?
Thanks so much for having me tonight. Yeah, I mean, we're hearing stories about cases going up in hospitals. We have the data. My hospital in particular, 2 weeks ago, we didn't have anybody admitted with COVID. Now we have about a dozen cases. And, I'm speaking to other colleagues in the GTA, and they're seeing rises in cases as well. So patients are starting to get admitted to hospitals. We're lucky so far that the number of patients in ICU hasn't increased dramatically yet, but it is a lagging indicator. So we definitely have to keep an eye on it. I think the other thing that's important, aside from obviously trying to prevent patients from getting sick with COVID, is that I worry about hospital staff getting sick. We are starting to see more hospital staff testing positive. It is likely because they're picking it up in the community. A lot of our staff have young kids, and those kids are, in places where they're not wearing masks, and they're playing, extracurricular activities and things like that. So we have to be concerned about that, because we don't want care delayed, things like cancer screening, cancer treatments, if we have staff off and we're treating more people with COVID-19. I agree with Dr. Bozzari. I'm trying to get the fourth doses out to the most vulnerable quickly is key. And we know this because the data in Israel showed that, the fourth dose doesn't work as well as the third, right? The immunity goes up, but it comes down pretty quickly within a few weeks. And so if you want to get ahead of, the wave that we're in, you've got to do it quickly. And just a reminder, please, for those that have yet to get their third dose, it is absolutely important to get that, especially, people over 50, because the immunity you get from the third dose does last significantly longer. And it's just a reminder that anyone that's due for a dose, it's time to get it now.
So, Dr. Grill, you mentioned, kids in the community, they're all back to school now, and that could be a cause of some of these cases in this latest wave. Dr. Kulik, how does this wave compare to the last for you, for what you're seeing, specifically when it comes to pediatric cases?
Luckily, we still haven't seen a lot of particular illness in young people. Certainly, a lot of our patients at Kid Crew are getting COVID. We're seeing an interesting mix now of kids that have a lot of rash symptoms with COVID, a lot like hand, foot, and mouth disease, what people usually characterize as that particular illness. Seeing lots of overlap of kids with confirmed COVID or family members with COVID, and they're presenting with rash, which I think is important to mention for those of you who have children that have rash. Don't just assume it's another virus and they couldn't possibly have COVID as well. I do think those families should be swabbing their children as well. But by and large, they're staying well, but no doubt there's a huge rise in cases that we're seeing in the community.
What about those pediatric cases? How serious are they?
Most kids do very well with COVID. They have throughout much of the pandemic. There are some kids that get very sick with COVID, but by and large, they stay well. Many kids with fever, runny nose, cough, rashes, stomach flu kind of symptoms. And with this, what I think is a new sort of variant or presentation with hand, foot, and mouth disease, a lot of kids are having uncomfortable rash, sore throat, sore mouth, which is a bit different than previous.
How do you explain that? Is it just presenting differently in a different age group?
I don't think it's because of the age per se, because I have lots of patients whose family members, parents have the same symptoms, the same rash, which we don't typically see in older people. I think it's possibly a new strain or a new way that this strain is presenting itself.
Okay, interesting. Dr. Buzari, we've been looking at the numbers. It is concerning to see cases and hospitalizations rise so sharply in such a short amount of time. How accurate, though, are those numbers? Talk a bit about where we're at with testing.
Yeah, I mean, I think one of the things, Chanel, that we have to be really clear about is actually how we as a country and as a province are doing on testing. And compared to our other peer countries, we're near the bottom of the pile when it comes to the ability and the prioritization of PCR testing and access to other tests. So this is where there's real concern that we're really not capturing the prevalence of COVID right now. And there's been other measures or techniques to go to wastewater, as there has not been the level of testing that we need given where we are in the sixth wave. So I think we've, unfortunately been through this cycle a number of times where there continues to be, this debate out there about, well, what is the true prevalence in terms of the cases? And we have to wait for this lagging indicator. Well, you don't have to wait that long. And this is where we're all very concerned, as Dr. Grill spoke to, the rise in cases and hospitalizations, especially already happening. And actually, if we look at some of the modeling from the Ontario Science Table, our hospitalizations are actually higher than some of the models predicted at this point in some of the sort of worst case scenarios. So I think this is something that's really serious in terms of where we are looking to see what the prevalence is, but we need to ensure that testing is made more available. And I think the other piece is we can't pretend that this is over. I think when we're not having access to tests, when there isn't the access to vaccines still for the third dose, as Dr. Grill has mentioned, we see huge disparities. And we're also seeing real different awareness when it comes to Paxlovid and other antiviral treatments. So we're really seeing a lot of barriers in place, and a lot of this is happening in the dark. And so we're going to have to see other measures, but really as we're starting to see hospitalizations increase, it's pretty clear where we're at and the kind of measures that we're going to need to put in place to protect people.
Yeah, that's an interesting point. So if we don't know the true number and the true prevalence in our communities, how do we know if these pandemic restrictions that have just been lifted are truly meeting the moment, Dr. Buzari?
Well, I think that's exactly it, Chanel. In terms of meeting the moment, I think that this is, really actually on the reverse. It's a situation where we need to see these measures in place when you see hospitalizations rising. So there's no ducking that, and there's no pretending that that's not happening. And so this is where we really need to ensure that as we're waiting, and we've been in this pattern on waiting to sort of see cases turn into hospitalizations or people having to be admitted to the ICU. This is not a public health approach that we can continue to take. It comes with a huge burden, not only to the health system, but various communities. And so really when we're seeing the effects, there's an experiment now of, how effective the mask mandates have been, or masking in high risk areas. And when we're seeing the sixth wave, it's pretty clear that, we have to see a push back to these non-pharmaceutical, these non-pharmaceutical interventions and things that people can do that do not have large cost benefit ratios. So I think this is something where we're seeing other jurisdictions have moved back towards ensuring that things like masking and better access to vaccines are in place. And I don't know how much longer we can wait on that to happen here.
Okay, I just want to end on something Dr. Grill mentioned earlier about third doses. We know less than 60% of Ontarians have so far had their third dose. So Dr. Grill, is there a really strong appetite at this point for a fourth dose?
I hope so. I mean, I think one of the things we need right now, and that's why I'm really happy you invited myself and my two colleagues on the show, is just we need very clear communication from our public health units and Chief Medical Officer of Health about the importance of vaccination. I mean, that message has been clear up to this point, but I think lately, as restrictions were lifted, there's been less messaging. So I think more messaging to the public emphasizing the importance of vaccines and the fact that they will significantly decrease your chance of a severe case of COVID-19, which will land you in hospital, which will land you in the ICU. It'll put pressure on our healthcare system. I know a lot of people who have been triple vaccinated and they've gotten COVID-19, a lot of my patients, and it's been very mild and they've done well. But I know a lot of other patients that unfortunately had much more severe cases. So we're trying to prevent that. So I think communication is key. I think targeting, as Dr. Buzari mentioned, the communities that might be more vulnerable are very important communities that may not speak English as their first language. We've got to use community leaders and leverage those relationships. To Dr. Kulik's point, we have to remind kids age 5 to 11, second doses are available. Please go out and get them. And again, you can contact your primary care provider, you can contact your local pharmacy, and you can contact many public health units still have clinics available, right? And the last thing I'll say is, even though the mandates are still not there, please wear a high quality mask. You know cases are up, especially when you're indoors. If you're feeling sick, stay home. Don't go to work. Stay home from school. Do a rapid antigen test to see if you have COVID-19. And for those that are eligible, as Dr. Buzari mentioned, for outpatient drug treatments, please go to an assessment center as soon as possible when you come down with symptoms. We have good drugs that we didn't have 2 years ago when this started that can keep you out of hospital. So let's keep up the communication, work together as a community, especially to protect the most vulnerable, like the elderly and the kids that can't yet be vaccinated.
Okay, I love picking your brains, but we've got to leave it there. We're out of time for tonight. Thank you so much for coming on. We so appreciate it. Dr. Andrew Buzari, Dr. Alan Grill, and Dr. Dina Kulik. Thank you.
Thanks so much.
My pleasure.